So today I'm going to give, sorry. Okay, excellent, thank you. So I'm going to start with a brief outline of my talk where I will give background to ENDS and the harm reduction opportunity that they present. And then I'm going to go on and describe our project stewardship process, how we screen e-liquid ingredients and flavors, and the preclinical assessment of these e-liquid ingredients and flavors. And I'll finish off with then some summary notes. So there's a growing body of evidence to support the fact that e-cigarettes and other ends do play a role in tobacco harm reduction, or can play a greater role in tobacco harm reduction. A number of institutes and public health bodies have come out in recent years with statements supporting people switching from cigarettes, traditional cigarettes, to e-cigarettes and other next generation products. And the benefits of these are becoming more clear over time. I've got an example of one of these, which many people will be familiar with, and that's the Public Health England statement from a couple of years ago, which said that e-cigarettes are at least 95% less harmful than traditional cigarettes. And as the growth in vaping increases and people switch more from cigarettes, this potential for harm reduction in the population can only increase. Now, BAT has published recently a framework for the assessment of risk of new category products, tobacco and nicotine products. And this is based on three main categories and three main steps. The first of these is emissions, followed by exposure and risk. And as you go from left to right on this graph, you increase the weight of importance the data give to this weight of evidence approach, but also increases the resources and time required to generate these data. So it's a bit of a journey in terms of generating the data required to substantiate risk. On the emission side, there are a number of different studies that can contribute to the data generated. And these include combustion studies, studies on the emissions from the product, as well as toxicology studies, which I'll talk about a little bit later. From the exposure side, we can get a lot of information from human use behavior and from clinical pharmacokinetic studies, as well as some of the clinical exposure studies that Nathan mentioned in his talk just previously. When it comes to clinical studies on individual risk, we can look at biomarkers of potential harm. We can look at population risk with post-market surveillances. And we can also do some epidemiological modeling to get an idea of what would happen if a new product was introduced into a market in terms of switching and uptake of that product on public health. So as I said, vaping presents a really huge opportunity for tobacco harm reduction. Currently, there are over 41 million vapers worldwide, and I've got some illustrative figures for vaping use in some other major vapor markets around the world. And flavors have a really big role to play in encouraging people to switch from smoking to vaping. And I've got an example from the UK market on the right of some of the main categories of flavors that are sold as a proportion of the e-liquid sold. So familiar flavors like tobacco, mint, fruit, etc. And it's this offer of choice to consumers that really gives them the ability to move consistently and permanently from cigarettes to new e-cigarettes. So with that background in mind, I'm going to give a little bit of detail on the toxicological assessment of ENDS that we perform at BAT. So a couple of years ago, we published our product stewardship process, and that's depicted here on the left. I'm not going to go into great detail on that, but what it is a real stepwise approach to looking at e-liquid formulations, what goes into those, and doing toxicological, initially desk-based risk assessments to identify ingredients that are safe for use and the levels which are safe, and that's indicated on the left. And then on the right, looking at thermal breakdown and reaction products. So these are the types of things that could potentially be formed when the e-liquid interacts with the device to form an aerosol. So both aspects are critical in the overall assessment of e-liquids and e-cigarettes. And we have some rules in terms of product stewardship, in terms of the ingredients that we put into our e-liquids to reduce the risk to as low as possible. So we use pharma-grade nicotine and food-grade PG and BG. We have lists of of basically compounds that we don't put into our liquids. Anything that falls in that list will not go in. And also carcinogens, mutagens, and reproductive toxicants. If they're identified in the screening process, they obviously do not go into any of the products. Also the same with respiratory sensitizers. And we also do rigorous electrical safety testing on the devices as well to look at that side of things. And just to say as well, the Committee on Toxicology in the UK produced a report back in March, which is looking at frameworks for e-liquid ingredients testing, and this aligns very, very closely with their own framework. So in some cases, there isn't potentially all the tox data available to allow us to make a decision. And in those cases, we do some preclinical tox assessments, such as the ones that Diego mentioned earlier. And over the years, the testing capabilities have really increased as there have been developments in both aerosol exposure and in cell biology. In the earlier days, we were really limited to very limited amounts of different types of test matrix. For example, total particulate matter, which is generated typically from a cigarette or traditionally from a cigarette by puffing onto a Cambridge filter pad, eluting the tar that's collected, and then using that as a test matrix. But that doesn't include all the gaseous and volatile chemicals that are present in smoke aerosols. However, it does have its use, and it is still applied in some testing strategies. Also, the cell systems have improved from 2D monolayer cultures, which are still useful for screening, but are limited in terms of more mechanistic information that they can provide. And the more traditional older tests, in terms of results, are really a simple one test leads to one endpoint type approach. Nowadays, we can apply many different types of test matrices, including whole aerosol, directly to lung cells, which is obviously much more physiologically relevant and gives information which can be more useful in risk assessment. And other different test matrices are also used for different purposes, depending on what the actual requirement is. The cell systems themselves have improved over the years, and now we've got 3D organotypic lung models, for instance, that Diego also referred to earlier, as well as organ-on-a-chips and organoids. And these provide a greater flexibility in terms of the types of tests that we can do, and also the information we can glean from them. And now these tests can give us multiple readouts, which allow high throughput screening and data-rich approaches. So we can get a lot more mechanistic information following some initial screening. So in summary, it's a greater number of endpoints, models are much more physiologically relevant, and there's a higher speed and throughput for screening. And I've illustrated this in a screening approach, which is a simple funnel type design, where at the start you may have a large number of e-liquid formulations or e-liquid flavors that you want to test. An initial cytotoxicity screen, for example, can be done on a 2D cell line, and that will flag up any potential flavors that could have adverse toxic effects, such as citronella, which was mentioned earlier. So these can be flagged out, and then final formulations or later products in the development pipeline can then be assessed using whole aerosol techniques, using 3D organotypic lung tissues. So you get a much more rounded evaluation of the toxicology following that initial screening. An example of how we've modified our traditional toxicology approaches can be seen in the AIMS assay, which is a traditional bacterial mutagenicity assay, which is predictive of carcinogenesis. It's a very, very well established, very well recognized and appreciated test by regulators. When we test regular cigarettes in this assay, we know traditionally they are mutagenic, and they give us a positive response in this assay. So on the y-axis of this graph shows the mutation revertance. So this is the amount of mutation. And you can see with the pink bar that traditional cigarette smoke at 24 puffs gives a very large positive response, similar to benzopyrene, which is the positive control in this instance. And this is using diluted smoke, because cigarette smoke aerosol is highly toxic and has to be diluted before it can be even applied into these assays. When we tested e-cigarettes using that type of methodology, we got a flat negative response. But we wanted to push the system as much as possible to see if that negative response really is negative in terms of pushing it to the extremes that the assay will allow. And so as you can see in the blue shaded aspect of the graph, we did undiluted vape e-cigarette aerosol, took out the dilution component, so therefore giving the most extreme dose possible. And then we puffed for an extreme number of doses out to 900 puffs. And as you can see with the comparison to the untreated control, which is in green, there was still a negative response. And at that top dose, it was the highest you could actually go for this assay. Other 21st century toxicology approaches and more downstream approaches complement the more traditional approaches, which are still very useful for screening, and they provide some mechanistic information on disease-relevant risk. And I've just got a couple of examples here. So on the top, we've got a mechanistic endpoint assay for CBD, which is endothelial wound repair, sometimes called the scratch assay or the wound repair assay. In this test, we make a scratch in confluent endothelial cells, so cells from the lining of the blood vessels. This artificial scratch is then monitored over time using image analysis. And at the same time, the cells are exposed to aerosol extracts from either your reference cigarette, in this case 3-or-4F, which is the red bar in the graph, or to the vape e-cigarette. And on the x-axis of this graph shows the dosage, so from 0 to 100% aqueous solution. The y-axis shows the rate of repair. And a consistent rate of repair is what you're looking for. And you can see with the vape that over time, the repair is consistent over the whole dose response. While for the reference cigarette, this repair is inhibited in a dose-dependent manner. And actually, we can't go beyond 40% because it is just, it inhibits repair so much and is actually toxic above that. So a direct and a very good indication of the difference between e-cigarettes and cigarettes in this particular biological endpoint. On the bottom part of the graph is an illustration of where we use international frameworks to build our weight of evidence. And the adverse outcome pathway approach is a framework that's been supported and endorsed by OECD. And it's basically a chain of events framework which links exposure to a toxicant to an adverse outcome. In this particular example, we're looking at mucus hypersecretion leading to decreased lung function, which is a COPD-related endpoint. And what this framework allows us is to look at key events in that pathway, so events that are causal and that move from from a molecular event to a cellular, to an organ, and to a tissue, so progression of the disease. So we can look at these key events in the disease progression and then overlay this with data that we can generate from multiple different sources, so proteomics, transcriptomics, and apical biological assays. On the right is an example of some transcriptomics data that we used to overlay against some of the key events in this particular pathway. So this is a very useful independent framework that is recognized by regulators. I'm going to change gears slightly and talk about how screening technology can also support public health assessment of e-liquid adulterants and contaminants. An example here is the EVALI situation which occurred last year, which was associated with e-vapor and e-cigarette use, lung injury. And this is characterized by macrophages that are laden with lipids as one of the endpoints. And this can be simulated in vitro and assessed in vitro. And in this particular example, we have macrophages which have been differentiated. And you can see those in those illustrations. Blue indicate the cell nuclei and green the lipids which have been stained in these cells. When we look at a typical PG-VG formulation of e-liquid, we see a background level of lipids that are ever present in cells. In the middle picture, you can see the positive control, which is oxidized LDL, and a much greater increase in lipids. And then when we looked at a PG-VG formulation where we've spiked in some vitamin E acetate at 2%, you can see a great increase in lipid accumulation in these particular macrophages. And so this model can provide some insight into the mechanisms of EVALI, for instance, and also be used as a screen to screen out adulterants or potential contaminants that may cause similar type injury as well. And coming to more current affairs, in vitro tools, such as the ones that I've described, can be used to investigate tobacco and nicotine product usage and on susceptibility and severity on SARS-CoV-2 infection, the current COVID pandemic. Expertise in aerosol exposure and the science involved in testing these products, exposing and doing the biological analysis can be turned to looking at some of the mechanisms potentially involved in SARS-CoV-2 infection. Examples of this are the ACE2 receptor, which is the site of binding for the virus in lung and many other cell types, can be detected using immunostaining and gene expression studies on in vitro and clinical studies from smokers, non-smokers, and from smoke and exposed cells. Also, the effects of nicotine on the inflammatory response to SARS-CoV-2 can be investigated. And it's been suggested that nicotine can play a positive modulating effect on inflammatory response. But it's very early in terms of having mechanistic information on these kind of pathways. So these kind of studies will add to the current weight of evidence in this area. Another area is potentially looking at virucidal activities of e-liquid vapors and aerosols. Propylene glycol has been shown previously to have virucidal and antibacterial activity, but it's not known or hasn't really been shown whether this translates into human use in vaping. So lots of areas where the technologies and expertise that I've described earlier can be applied in different areas. So in summary, vapor products used by millions of people across the globe, and this provides a great opportunity for tobacco harm reduction. In vitro models, such as the ones I described, play a big part in both toxicity assessment and the placement of products on the risk assessment continuum using the framework that I described earlier. And it's really, really important to note that good product stewardship and high quality manufacturing enables vapor products that can play a role in tobacco harm reduction. With that, I'd like to thank everybody from the team, from product stewardship and from preclinical science who've contributed to the work and the ideas and concepts that I've captured in this presentation. And thank you all for listening, and I look forward to any questions.